Thank you for joining us.
Thank you.
What are the main difference in the modality of renal diseases from this country or in your region or from the West?
I think overall it's quite similar in terms of the group of patients that we see. Um, but I think predominantly the risk of hypertension and diabetes is very prominent in Bangladesh.
Okay. So related complications and other
Yeah,
issues.
yeah. A lot of
So,
them end up with with kidney problems, kidney diseases.
what are the cutting edge services that you provide? Like transplantation is one thing,
Mm.
kidney transplant,
Yeah.
but it's also happening in our country.
Yes.
So, for example, on a business point of view,
Mm.
if I ask you why patient should seek treatment in your country,
Mm.
what are the services that you are offering are
Okay, I
not
think
available here?
the apart from the transplantation part, which is I think is quite rampant everywhere. The services that we have apart from the transplant part is the dialysis. A little bit of difference is that lately, the past few years, there's a lot of talk about hemodiafiltration. I'm not sure whether you've heard about
Okay.
hemodiafiltration. This is actually another form of hemodialysis, but it's uh,
What's the term?
hemodiafiltration.
Okay.
Yeah. This is a little bit more advanced form of dialysis where when we do hemodialysis for a patient, we the type of or the method of doing the dialysis itself is a little bit different from the conventional dialysis. Basically, the filters are different, the machines we use are a little bit different, and the advantage of this form of dialysis is that it is useful for patients who are with heart problems, where sometimes they may be unstable on hemodialysis. Hemodiafiltration afford a little bit more stability for their heart problem, if they have heart problem. The other advantage of the hemodiafiltration is it actually helps to clear better. Patients, a lot of them maybe big size, and the clearance may not be adequate. So hemodiafiltration actually helps to increase the clearance of the toxins in the blood.
So, um, does it provide any benefit in comparison to the conventional dialysis for less frequency or any other compliance issue?
I think there's no head-to-head comparison between if you do hemodiafiltration less frequency versus conventional dialysis with normal frequency. There's no head-to-head comparison. But we know that if you do conventional hemodialysis, if you do daily conventional hemodialysis, it's actually better than the dialysis, which is three times a week, for example.
Okay.
But if we do hemodiafiltration, generally, I mean, I have patients who go on hemodiafiltration and they do twice a week dialysis. But I mean, this is not the way that we want to.
So, what are the main reasons that heart patients get more benefit from this?
It affords a bit more stability in terms of blood pressure. Yeah, because a lot of the heart patients when they do hemodialysis, blood pressure drops, they become unwell. Yeah, so hemodiafiltration gives them a little bit more stability in terms of cardiac stability.
Is it more expensive?
Yeah, definitely. The filters are different. The machine is a little bit different as well. Yeah.
So we are seeing the dialysis technique for a long time.
Mm.
There has not been that significant changes.
Mm.
For example, if I say about the insulin, so insulin pump, and that kind of thing. So,
Yeah.
is there any advancement in portable kind of dialysis or that?
There's currently some research that's going on with regards to the wearable dialysis, which is a few countries are actually are developing this. Singapore has got one company which is developing a portable dialysis at this point in time. This is a variant form of peritoneal dialysis, where you bring the machine around and then it's now still right now in development.
Okay. So, can you tell us about some lifestyle modification for avoiding kidney disease or the patients who need to modify their lifestyle?
Yeah, I mean, I see a whole range of patients, and usually when they come to me, a lot of them would have. Um, I mean, lifestyle is okay. One of the things that when we talk to patients, when we when we talk to them about treatment, they don't want. They say, "Oh, can we avoid medications or reduce medications?" So lifestyle modification is very important. Um, we look at the risk for development or progression of kidney disease, high blood pressure, diabetes, cholesterol, protein loss in the urine. These are risk factors that actually increases the risk for progression, including their habits, um, smoking, for example. So when we talk about lifestyle modification, it actually basically centers around few uh, uh, these few things that we want to manage: blood pressure, reduce the salt intake, diabetes control is important, reducing sugar and being in control of the sugar, and for that, between hypertension and diabetes, exercise comes in. Okay. Being active in their lifestyle, promoting exercises, reducing weight, and then avoiding stop smoking if they are smoking. Thanks.
Okay, thank you.